Hi, my name is Jessica Wonders. I'm a certified integrative women's health coach with a specialty in endometriosis. This content, part 3 in the 3-part series for supplements and herbal remedies, is for educational purposes only. Please always speak with your physician, your surgeon, your nutritionist, your dietitian, whomever is your licensed healthcare professional regarding the information shared here. I do discuss dosages and things like that. These are based on general recommendations. Always, always, always go with the advice of your own doctor. I am going to share my screen and we're going to get right into it today. Essential minerals for healing. Now, because surgery often involves skin, bone, muscles, and joint healing, you may want to take additional amounts of certain minerals that aid in healing. And they are best taken before bedtime. And as they can be, oftentimes these minerals can be relaxing to the system. And the very first one is one that I take right before bed personally, and that is magnesium. This promotes wound healing. It's important for the production of proteins, the function of certain enzymes, and energy production. It can help reduce pain by relaxing muscles post-surgery, as well as help you sleep more deeply. It is useful for pre-surgery jitters and useful for post-surgery constipation. Typically about 800 milligrams is what's recommended. You do need to know with magnesium that there are different types. And regarding the endometriosis community, there are certain types that can be good or bad for you. So make sure you look over what the different types are and choose wisely. And by the way, if you're wondering like the breakdown, all of that, that's going to be in your course materials. So just go read the information there and decide what's best for you. Selenium. Now, this is an essential trace mineral. It supports the immune system and helps prevent infection. Selenium deficiency has been detected in post-surgical gastrointestinal patients. Now, deficits can lead to wound healing problems. A multivitamin should provide between 100 and 200 mcg. A safe upper limit for adults is 400 mcg. Exceeding this level could cause fatigue, nausea, and diarrhea. So it's best not to exceed about 200 mcg daily. Calcium is a bone builder. It's essential for proper nerve and muscle function. It's essential to healing of muscle and bone. Best taken apart from meals and right before bed. Protein interferes with uptake of calcium into the bone, and calcium citrate and malate and calcium orotate have greatest bioavailability. So keep that in mind. Bioavailability is like how well it's able to absorb in your body. Zinc. Aid to wound healing and proper connective tissue formation. Immune booster increases the transport of vitamin A from the liver to the skin, helping protect body tissue from damage and repair any damage present. It's a powerful additional pre and post surgery. Zinc picolinate, I'm saying that wrong, but it's zinc pico. It will be referenced on your guide because I always screw up how to pronounce these things. 45 to 100 milligrams, if not in a multivitamin. Check with your physician about using, since while taking any antibiotic, like warfarin or something like that, just check to make sure it's okay to also add zinc in there if you're taking something like that. Researchers in Spain measured the preoperative blood levels of zinc and other nutrients in 97 patients who were to receive an arthritic degenerative hip type surgery. And the investigators then analyzed, or researchers then analyzed the various nutritional parameters with respect to how quickly each patient healed from surgery. There was a highly significant relationship between serum zinc levels and delayed healing in the post-op patient period. Patients with low zinc levels, so below 95 mcg DL, were 12 times more likely to have delayed healing compared to patients with normal blood levels of zinc. So getting enough zinc can support better healing if you're facing surgery for bone fractures and potentially other types of surgery as well. Helpful tips. Use a high quality multivitamin formula that encompasses many of these vitamins. Some vitamins or minerals such as vitamin C or zinc may be taken apart in higher doses. Should have vitamin A and as beta carotene, and vitamin B1, vitamin B2, vitamin B6, vitamin B12, vitamin C, D3, E, K, niacinamide, pantothenic acid, iron, copper, chromium, zinc, selenium, and magnesium. Don't worry, guys, all of that is in your guide. So all of those vitamins I listed are what you would want to look for in a multivitamin formula. And then an antioxidant formula can take vitamins, minerals, and supplements in the form of an antioxidant formula for 1 month before surgery, ending about 10 days before the procedure, however. This formula should contain moderate amounts of vitamin A, C, D, and E, in addition to L-glutathione, zinc, coenzyme Q10, and selenium. It can ensure increased energy and well-being during post-surgical recovery, even if you stop at 10 days before. Probiotics. This is live microorganisms thought to be beneficial to the host organism. An example would be lactobacillus, acidophilus, and bifidus. These are all found in common yogurts that you can buy at the grocery store. Those two listed. Drugs administered during surgery can offset the balance of intestinal flora. Keep that in mind, especially antibiotics. They will wipe out your gut health and you will have to start over. I hate to be the bearer of bad news. Taking a high quality probiotic before and after surgery is, helpful to maintain proper balance of intestinal flora and assist in bowel function. Formula should contain 15 billion live organisms. Most effective ones are refrigerated. Be sure to take a probiotic after surgery if you receive antibiotics or, steroids to prevent a yeast overgrowth in the gut. Immune boosting formula, geared to assist fighting post-surgical infection. If your system is weakened by drugs, alcohol, cigarettes, anesthesia, stress, poor diet, previous bacterial infection, or other illness, there are many products available that blend the ideal amount of vitamins, minerals, and probiotics to enhance your immune system. Ideally, it would contain small amounts of zinc, vitamins A, C, D3, and E, golden seal echinacea, bioflavonoids, probiotics, and proteolytic enzymes. Now, stop taking any supplements with amounts of vitamin E over 30 IU at least 2 days before surgery. Key amino acids. Clinical studies have shown that adding amino acids to one's diet may improve the healing process after surgery. You may want to take a formula with a variety of amino acids if depleted before surgery, and you can take amino acids individually for specific results as well. L-arginine aids in wound healing. It's a growth hormone releaser and triggers the body to make protein. If you have a heart condition, advise your physician before taking this. L-cysteine, sulfur-containing amino acid, helps heal internally and externally, necessary for collagen production, powerful supplement for recovery from burns and surgery. It works best when taken with vitamin E and selenium, though. L-glutamine, essential protein needed to repair muscle tissue, helpful to repair leaky gut syndrome, avoid if you have kidney or liver problems. A helpful tip here, try a high quality amino acid formula that contains all of the previously mentioned amino acids. Here is our last slide. You can find me at jessicawonders.com, endowonders.com, or on social media at sunfirepoppy. Demand better care, period, guys. Now, I lied. I said that this was 3 parts, but I've actually decided to add a 4th part to this series, and that is going to be about homeopathic remedies specifically. So make sure you watch the next video in this series. And thanks so much. Have a great day.